Good day, Sir Chris. This case study presents a comprehensive analysis of an Arnold Chiari malformation diagnosis using magnetic resonance imaging of the spine. This report details the MRI findings, characterizing the malformation's specifics, and exploring diagnostic and treatment implications. We will analyze the imaging data to determine the malformation's extent, identify associated anomalies, and assess its impact on neurological function. This report is structured as follows. First, a case summary will be provided by Ms. April Grace Facturan, followed by a description of the relevant clinical pathology by Mr. Rafi Lim. Next, the MRI methodology, including the specific pulse sequence used, will be detailed by Ms. Laika Javier. Finally, the MRI findings will be presented and interpreted, leading to a discussion of the results and their implications for diagnosis and treatment.
A 34-year-old woman sought care for headaches, dizziness, photophobia, or sensitivity to light, and temporary loss of vision, aggravated by postural position while bending forward. She would also experience dizziness while brushing her teeth, and she had unprovoked episode of nausea with dizziness that would disable her for 20 to 30 minutes. The episode of nausea and dizziness would happen 4 to 5 days a week, 3 to 4 times a day depending on her activity.
We are going to present a case study about Arnold Chiari malformation. But before we proceed to the case study, let me just give you an overview about what Arnold Chiari malformation is. So, the history of Chiari is first discussed in 1890s by Hans Chiari. Chiari malformation is a condition where part of the brain, specifically the cerebellum, pushes down into the spinal canal. This can happen when the brain doesn't develop properly or when there is an extra pressure in the skull. It can lead to symptoms like headaches, neck pain, dizziness, and balance problems. There are four different types of abnormalities. Type 1 carry, in which the herniation of the cerebellar tonsils below the level of the foramen magnum. This is considered the most common and often mildest form. Part of the cerebellum, the brain's lower part, pushes in the spinal canal. It may not cause symptoms but can lead to headaches, neck pain, or balance issues. Next is the type 2 carry. Type 2 carry is the herniation of the cerebellar vermis and medulla below the level of the foramen magnum. This type is more serious and is often present at birth, which involves the cerebellum and other parts of the brain pushing into the spinal canal. It can cause more severe symptoms compared to type 1, including problems with movement and development, predominantly seen in patients with myelomeningocele. Next is the type 3 Chiari. Type 3 Chiari is an occipital encephalocele. This is a very rare and severe form, where a large part of the brain protrudes into the spinal canal, which can cause serious neurological problems and is often noticed early in life. Surgery is a must in this type of Chiari. And lastly, the type 4 Chiari. This is the most severe type and involves underdeveloped cerebellum which doesn't fully form. It often causes severe neurological issues and is usually diagnosed in infancy.
Good evening, sir. I am Laika here from Group 2. So, my topic is about full sequences used. So, first is T1 weight imaging. So, what is T1 weight imaging? It's all about that is used for anatomical detail assessing cervical herniation and distinguishing CSF from neutral tissue. So second is D2, guided imaging is used for highlights CSF species and helps identifying cernogomelia. Sorry. So so next is a fluid attenuated inversion recovery. So that is suppresses CSF signal to enhance visualization of abnormal parenchymal changes. So last is sign based contrast MRIs evaluate CSF fluid dynamics at the foramen magnum useful in diagnosing um, Chiari related CFS obstruction. So at last is all about sagittal and axial MRI sequences. That is about to provide detailed visualization of the craniocervical junction and spinal cord abnormalities. Thank you.
So this was her scan. So you see a couple very characteristic findings here. Hopefully you can see my cursor. But on a sagittal T2 of the cervical spine, you have a pons and medulla, and then you have the cerebellum back here. And you see this kind of elongated portion of the cerebellum extending down into the upper cervical canal. In addition, you see this hyperintensity within the cord that tracks all the way down, and this is the kind of a cross section of that. Upon further imaging all the way down, you can see that hyperdensity and the cord really extends down to the mid thoracic spine. So, so of course, what is her diagnosis? As a clue, because we were talking about Chiari, her diagnosis is a Chiari 1 malformation or the type 1 Arnold Chiari malformation. With this associated with syringomyelia.